Parkinson's disease is a neurodegenerative disorder of the brain, where in the brain there is something called substantia nigra. This is a place where dopamine, which is a neurochemical, is secreted. Usually when people go old, maybe after 60 years, this dopamine level reduces. But for some reason, which nobody knows exactly, the dopamine level can drop to more than 75% in the area called substantia nigra, which can lead to Parkinson's disease. Parkinson's disease, there are 4 important symptoms. One is the hand shaking. That means when a patient is sitting quietly and watching movie or a TV, so hand will start shaking, something like this. It is called resting tremor. So usually these tremors are observed by patient relatives. Actually, I get patients saying that, sir, I don't have any problem, but my wife is having a problem that I have a shaking of the hand. So these are the actual symptoms. Actually patient's relatives will come with the patient and says that they'll have tremor. The second common symptom is slowness. Again, usually we have come across when patient comes to us, like husband and wife are walking in a park every day morning, the wife or the husband will notice, sir, my wife is not moving her right hand properly when compared to left hand. That means there is a slowness of activity on the right side of the body or left side of the body. So that slowness is the one symptom. The third symptom is stiffness of the body. So when I get up in the morning, it is difficult for me to get up, turn in the bed, and moving hand and leg is little difficult. Turning in the house or turning or rotating in the house is little difficult. It is not as, I'm not stable while walking. These are the symptoms which usually patients will tell us with the Parkinson's disease. But few people, when the Parkinson's disease increases in the severity, their posture will change. They'll actually have a bended or a stooping posture. They walk very slow. Their steps are very small steps. They'll keep small steps and they walk. They might fall. They might fall backwards or they might fall forwards. There are some other symptoms which are like constipation, which is going on. They might lose smell. They might not be able to have a normal smell. They usually tell, I'm not able to feel the smell nowadays. And sleep also they might get disturbed. They might become little irritable. They might have depression sometimes. So they might have joint pains. One joint movement is less. So these are all the some few rare symptoms of Parkinson's disease. But the commonest symptoms are the hand shaking, the tremor. Then they'll have stiffness. They'll have slowness and postural imbalance, fall while walking. These are the commonest symptoms of Parkinson's disease. As I told you in the beginning, the Parkinson's disease happens because of the deficiency of a neurochemical called dopamine. Same dopamine we can actually give to the patient through oral medicine, so that that chemical will go to the substantia nigra and it produces its action. So there are variety of dopamine treatment. One is a levodopa, it is a tablet. Then we have a carbidopa. Then we have some dopa agonist medication. These all medications will work wonderfully to a patient with Parkinson's disease for first 5 to 7 years, which is called honeymoon period. So once the treatment of 5 to 6 years, they are very happy with medicine. They say that, sir, whenever I take medicine, I'll do fantastic work. I become nearly normal. But as the day increases, the efficacy of this medicine comes down and they start having side effects. Those side effects are, they'll have abnormal movement in the hand, leg and neck. It is called like dyskinesia. They'll have something like the abnormal and increased movement of the hands, legs and the body. So, and their effect, usually they'll tell, sorry, when you started medicine, it used to work for 3 hours, 4 hours. Now it is working only for 2 hours. So the efficacy of the medicine comes down after 5 to 6 years. For those patients who are Parkinson's disease, and they are doing very good response with a levodopa tablet, following years, like after 5 years or 6 years, if the efficacy of the drug comes down, we have a new treatment which is called deep brain stimulation, where we will put an electrode in the brain to the subthalamic nucleus, and we'll keep a pacemaker battery here, which is something like a pacemaker of the heart, and we'll stimulate here. It will stimulate the brain, and which actually produces a negative symptom. That means the patient improves, the Parkinson symptom improves, which is a recommended treatment for Parkinson's disease, who will not respond to levodopa only after 4 to 5 years of treatment. So these are the two important treatments. One is medical management, other one is surgical management.